I think you will be listening to me, majority of you will be listening to me for next 2 days. Yes, you will be bored of me. Alright? Okay. Now the important is, first of all, I recognize who are on the stage. Larissa being, the moment I spoke to Larissa, she said, okay, we want this course. And the approach, the way she, dealt with my communication and the commitment I would see from Larissa to get all you into this course, it's been brilliant. Okay? And P. Devan, I just met him briefly, and personality, amazing personality I have observed so far, and very down to earth. That is what I could say. Okay, thank you guys. And now my keynote message would be, there are two things are important for nursing education. One is, nursing is a profession, and autonomy we got to have, and the recognition, which is lacking in India. Still we are struggling. Okay? And who are the people that can change? That you guys are the people who can change. Okay? Still, you guys are the people who can change. Right? Second thing I would say, it's about the quality of education. Quality of education and learning what we have beyond our profession. I would say beyond our degree, graduation. Okay? What education you have. I think that norm is coming to India. Okay, India, once you are graduated, that I would say that is done. And you go to work as a staff nurse, following that, okay, you are expected to learn by yourself. Where in developed countries, difference is, any skill which you don't practice for 3 months, you have to do an update. Any skill, if you don't undertake for 12 months, you have to take full training. That is the difference, because we are human beings. Okay, we won't be knowing everything on this head. There are millions of calculations will happen in the head, but we don't expect to know everything. Do we? Okay? And one of the things common in India, another observation of mine is, when you go to a doctor, what happens? Very rarely doctor refers to a book. I'm not sure now, might be, but last year when I observed, I went myself to a doctor, very rarely doctor refers to a book. Okay? Or even a nurse practitioner, very rarely you will be referring to a book. Reason might be, patient might be thinking that you not know it. But where in developed countries, in UK, you always refer to books. Like medication before prescribing, you need to make sure, refer to it, you prescribe the right medication at right time. It might be the chemical name might have changed, some names might have changed. It is important that right medication, because of the policy and generalized policy they have all through the country, and the legality behind it. Okay? And you can't do a mistake. Okay? If you are doing a mistake, you can learn from it, but again, that will be going under the root cause analysis. That is, I would say. Okay? Further development, what you do, that counts. Laxmi Institute of Nursing has taken into consideration that, okay, these are the future nurses,
gold medalist once in 1991 and again in 2008, both for P.G. Vishwanathan Gold Medal in Breast Research. He has also instituted gold medal name Dr. Devan Gold Medal for Innovations in ENT since 2001. He has also authored chapters like mastitis, e-medicine, to name a few. He is also a sub-editor of International Postgraduate Journal of AGIMS and Journal of Science of Healing Outcomes. There is much more to say about his achievements, but at the moment I think this list of his achievements is enough for us to know this dynamic personality. We are very happy to have you among us, sir. Now I kindly request you to share a few words of wisdom with us.
Morning, Mr. Gilbert, Madam Larissa, faculty members, and brilliant students eagerly looking forward to the wealth of wisdom that will flow from Mr. Gilbert. Now, I was just asking him, did you know why we lit the lamp this morning? Towards the fag end of our education, most of us have large areas of darkness. Guru is a word that symbolizes the teacher. You know why it is so? Gu means darkness. R means light. And when light touches darkness, it always dispels it and brings in wisdom. And that is the symbolic meaning of calling the person Guru. And here we have an enlightened Guru in our midst, far more knowledgeable than most of us, willing to share his wealth of experience and take you to the next level. And when we light a lamp, we symbolically shed the darkness that pervades here and brings in the brilliance of light and knowledge and takes you to the next level. Be the best at what you do. Be the best at what you do. The world will come to you. You know, we are at risk, both you and patients. 17 nurses in the last few years have got infected with the HIV virus. You know that? You are in a very troublesome area of work and you've got to be very careful. And he will show you also, I hope, during this 5 day how to take care of yourself. Many nurses have seen getting infected in the eye, in the lung, and all sorts of methicillin-resistant hospital infections are quite common. And therefore, you've got to be taking care of yourself first. Because believe me, when you laugh, the whole world is there. When you cry alone. So take care of yourself first. Now look at the other side. Since 1997 onwards, more than 3,000 patients have died as a consequence of mistakes by nurses alone. More than 65,000 people die a year as a consequence of mistakes by doctors. One decimal, one dot can kill. These are called decimal deaths. When you write a drug, it's writing 0.25 and you can write 2.5. That's everything. And decimals can kill. A point full of patients are the ones that die every year as a consequence of doctor errors. So you've got to be very clear. I'm so happy that at least doctors have the humility nowadays to open a book and refer and write a drug because things can go horribly wrong. And therefore, sort of to take care of yourself and to protect the patients, the same. And we have a wonderful, learned man amongst us. You know, William Shakespeare said, there comes in the life of every person a storm. Catch it by its horns, it takes to great heights. Shakespeare also said, believe and it is possible. He believed that he could achieve. And from his humble beginnings from Udupi, a small town, look at the height which he has. You know, all of us are very myopic. We think, oh, this is the only amount I can grow. But believe me, you think big, the world will come to you, your aid. You think of big achievements, the universe will conspire to make your dream come true. So there you are, powerful potentials in your hand. Wish you all the very best. Do well. Thank you very much. God bless.
Thank you, sir, for enlightening us with the thought-provoking words. We are delighted to have among us Dr. Martis, Principal, Laxmi Memorial College of Nursing. She is a woman behind all the progress of LMCN, a strong backbone, pillar of strength, and a motivating force in all academic and related activities. She has been kind enough to grace her presence here, so I request you, ma'am, to share a few words with us.
Dear Mr. Gilbert and Dr. P.P. Devan, faculty members, and the students who are the recipients of the benefits of this workshop, who will be gracing me 2 days. So I request each and every one of you to make use of this workshop to the fullest extent. And after 2 days, you will be enriched with not only the knowledge as well as skills that could be achieved in these workshops. That's the main objective of this. So I have always a dream. Nurses should always be the ones to decide for themselves what they have to do, and not someone else. But nowadays it's still happening because we lack in so many areas. The knowledge and skill being one of those. So this is one such small effort where I thought our students could benefit to some extent from these 2 days and consider themselves to be better than the other counterparts of theirs by undergoing these workshops. So dear students, utilize the opportunities and at the end of the 2 days, be the one to say whether it was beneficial or not beneficial. As he has already said that it's got a evaluation saying that it was much more than what was expected. So I do not know what is your objective or the expectation that you have come to this program, and I would definitely like to see a much more better and a favorable response at the end of these 2 days, so that you could say that yes, I have done it in these 2 days. And I wish each and everyone all the best and a fruitful days ahead of you. Thank you.
Thank you, ma'am, for enlightening us with great ideas. The world has enough beautiful mountains and meadows, spectacular skies and serene lakes. It has enough lush fields, flowered fields and sandy beaches. It has plenty of stars and the promise of a new sunrise and sunset every day. What the world needs more of is people to appreciate it, enjoy it. This entire program today would not have been so successful and coordinated if it wasn't for the different persons concerned. I would like to extend a sincere gratitude to our chief guest, Mr. Gilbert Nelson Martis, for enlightening our delegates with your persuasive message. Thanks a lot.